One of the biggest concerns now around the world is the new mutant strain of the COVID-19 virus. It's broken out in the United Kingdom. There have been a very large number of cases which have been reported over the last several weeks in parts of the country, particularly in the south and southeast of the United Kingdom. Hospital beds are filling up fast in that country, and the big question is how long will it take before this particular strain of the virus is brought under control? Joining us now, perhaps one of the best voices in the United Kingdom to answer that question, Dr. Chand Nagpal joins us. He is a doctor. He works as a general practitioner, also the chair of the Council of the British Medical Association. Thanks, Dr. Nagpal, for being with us. Firstly, the hospital situation in the United Kingdom. How critical is it presently?
Yeah, we have a very serious problem now because hospitals in England, many are seeing more patients now with COVID than during the first wave. We have many hospitals at full capacity. Only last week, 44 ambulances had to be directed away from the local hospital to other remote areas because there just were not the beds. And so we have a very serious critical situation in terms of our hospital capacity. And a lot of this is being driven by this new variant that has resulted in significant escalation of spread of infection, especially in London and the southeast.
Dr. Nagpal, what percentage of hospital beds remain in the United Kingdom at the moment?
We're seeing in some hospitals literally full capacity of beds. We've seen about one-fifth extra beds occupied by COVID in just 1 week. We're looking at occupancy levels around 90% or so, which means that there's very little laxity to accommodate urgent patients. That is the problem. And as I said, some hospitals are just completely full and are directing patients elsewhere. We have a National Health Service which has a duty to look after anyone who is seriously ill. So, there is this is a national issue for government. And the only way we will be able to control this is by reducing the spread of coronavirus, especially this new strain. So all of the efforts now are around controlling it. What we've done in London and the southeast is we're now in what's called Tier 4 restrictions. That means that no households are able to mix, only indoors at all. Only one person can meet with another person outside a household outdoors. All non-essential shops are closed. There is a ban on travel from areas in the Tier 4 restrictions, such as London, to other parts of the country. As you know, it's Christmas coming up, and there will be no mixing of families in the Tier 4 areas during Christmas. And in other parts of the country, there will be a very limited mixing on Christmas Day itself. So we are under severe restrictions nationally as a result.
A clarification: by saying that your hospital capacity is at 90% plus utilization at this stage, are you talking about dedicated beds and facilities for COVID patients, or are you talking about all beds put together?
Yeah, we're talking about all beds. And I think that's the other point, that not only is this having an impact on COVID patients, who are, of course, in highest numbers, increasing utilization of hospital capacity, but also this is having a dramatic effect on all other patients who may have acute respiratory diseases, who may have heart conditions, rheumatological conditions. In fact, this knock-on effect has resulted in millions of patients who are waiting at the moment for hospital treatment who were not seen during the pandemic. We have about 160,000 patients now waiting more than 12 months for operations. So this has had a huge impact on the health of patients at large beyond COVID.
Dr. Nagpal, is it true that there are younger patients coming in with this new strain?
Well, what we know is that younger patients are mixing more. We know that they don't have symptoms necessarily, so they don't even know they're carrying the virus. About 1 in 3 people do not know they're carrying the virus. And as a result, they can be the spreaders of the virus without knowing. And that's why it's really important that there are measures to prevent mixing of people. That's why we've got all the bars, restaurants, all closed at the moment in our restricted areas. So it's certainly a very real concern about spread. We've also introduced in the UK lateral flow tests, mass testing, which is picking up many people who are carrying the virus but don't know about it. That's becoming implemented across healthcare sectors so that we can identify asymptomatic spreaders. And on top of that, we have, of course, started our vaccination program, COVID vaccination program. We were the first nation in the world to start that. About 500,000 patients have already been vaccinated against COVID-19 using the Pfizer-BioNTech vaccine. And we've targeted those patients who are at highest risk. Those are people who are over 80 years of age and with other underlying medical conditions. So there are real efforts being made to prevent this infection spreading, but also to protect people as well.
Dr. Nagpal, will the vaccines work as effectively against the new strain?
Well, as you know, this is very early days, and so none of us can be absolutely sure. But the early scientific advice is that the vaccine should be effective against the new strain. That's what we've been told. But of course, I think we have to be very guarded in our position, because time will tell as the science unfolds. So we'll have to wait and see. But what I would also want to emphasize is that the measures that need to be taken with a new variant, and remember, this new variant is not an unusual phenomenon. Mutations occur with viruses all the time, and they have occurred with every flu season. But what's important is the measures are exactly the same as with the original coronavirus, which is to make sure that people do not mix, make sure that there's proper distancing between people, making sure you wear masks, hand washing. If you follow those rules, that will prevent spread of this new variant as much as it will prevent spread of the original virus. The only additional factor to recognize is that this new variant is more transmissible. It is considered to be around 70% more infectious in terms of spread compared to the original virus.
Is it more deadly?
There's no evidence at the moment that it's more deadly. It's passed on more readily, which is why we have to take extra precautions to prevent spread. But there's no evidence that the effect of the new mutation is any more deadly than the original virus.
Dr. Nagpal, to the best of your knowledge, if we need to revise some of the vaccines out there, typically how long would that process take? And then how long would the process to actually stock up on a new vaccine or a modified vaccine take after that revision?
I think I'd rather not us think in those bleak terms, because the scientists are telling us at the moment that there is no reason to believe that this the current vaccines that are available will not be effective against the new strain. Now, obviously, if things change, we'll have to revisit it. I think it's very hard to answer your question, because it would require a modification of the current vaccines. I don't think there's any precedence in terms of the way in which this vaccine is being produced. We produced a vaccine globally in 10 months, which would have ordinarily taken 10 years. So we certainly know that where there is determination, we do collectively across the nation, scientists will deliver what's necessary. But at this moment in time, I don't want to be for us to be portraying a bleaker picture than the science tells us at the moment.
Dr. Nagpal, given the present rate of vaccinating British citizens, how much longer would it take before you believe that a sufficient number of citizens have been vaccinated to give some sort of protection against even this new strain, and in the process bringing down the R rate, as it were?
Yeah, so I'm going with the assumption that the vaccine will be effective against the new strain. That's what the scientists are saying we should be assuming. Now, we've estimated that it's going to be at least until April or May that we would have vaccinated sufficient volumes of the population to really be able to say that the pandemic is in a way allowing us to mix like we used to do in the old days. So it's going to take at least until April or May. Now, that means, therefore, that what the messaging to the public in the UK is that whilst there is hope for 2021, the measures to prevent spread and the vigilance that everyone needs to adhere to is exactly the same, and that no one should let down their guard thinking that things are going to be okay in a short while. They're not. It's going to take several months. I should also say that the vaccination program itself is quite a major task. I'm a GP, a family doctor, and we are now almost full time. Some of our doctors are spending in just vaccinating people, because of course the quicker you can vaccinate the population, the quicker we'll get to that point that you describe, where enough of the population is vaccinated that we can start to mix more freely, because the virus effectively will not be circulating in any significant numbers. But actually to vaccinate the entire population, or not the entire, but the majority of the population, is a huge undertaking. And it's taking doctors, nurses, other healthcare staff, away from their normal roles in order to deliver this ambitious but necessary vaccination program.
Dr. Nagpal, the reason I ask that is, if it's going to take a few months more to vaccinate a much larger number of British citizens, would it be fair to expect that a transport ban, which has been called by several nations around the world, would likely remain?
I think that this is a fast-moving area. As you've seen with this new variant, that things can change, whilst we're implementing the vaccination program. So I do believe that we're going to need to continue adhering to the same measures we've had to adhere to in the past. Now, that means transport bans if you have a new variant like we have now. It will mean continuing with lockdowns if there are surges of infection in certain areas. It will mean adding new restrictions if things become uncontrolled in any one part of a nation, or so forth. So I think that whilst the vaccination program is underway, that it doesn't change any of the current measures and policies that we have to follow to control this virus.
One final question, because this affects thousands of Indian students who study in the United Kingdom. Many of them are stranded in the UK, unable to get home because of for Christmas, because of the ban on the suspension on air travel. But I think a lot of students would also want to know, if, irrespective of whether they're in the United Kingdom unable to come home or are already in India looking to go back, whether it's likely in January there will be a term of college. At this stage, what do you believe?
So this is a hot issue being discussed by politicians who govern the country, of course, because there has been a big debate around the cost of education, or children not being educated if we close down schools and educational establishments. But at the same time, there is a serious issue of protecting the nation's health and making sure that we don't end up with the loss of more lives. We've lost 65,000 people from COVID in the UK. And on top of that, there'll be many patients who didn't have COVID who weren't able to be treated. So we do have to put the health of the nation first. So at the moment, no decision has been taken. But if there is a suspension of physical attendance at colleges, universities or schools, what will need to be done in place is more virtual learning. And there is now plenty of evidence and innovative approaches that are going on across the world in terms of blended learning and ways in which students can learn in a safe way remotely. So no decision has been taken, but I have to say that that is certainly an option, that come the new year, we may find that there will be delays in the reopening of educational establishments.
Last question. Prime Minister Johnson is expected to be in India next month as our Republic Day guest. In a situation like this, do you believe realistically he would be traveling? I know you can't answer that directly, but given the situation in the United Kingdom, the threat of this new variant, would it be wise for him to travel?
Well, obviously, we can't make a decision today about what may go on in 5 weeks' time, because as you know, we've seen that the changes to the reality of this virus, on a day-to-day basis. But clearly, one consideration is that the trip to India may not be possible, especially if we carry on seeing this level of infection and spread. If something dramatically improves, if the current lockdown in London and the southeast, improves the spread of virus significantly, and we control infection within the UK, that may be possible. But remember, it's not just the UK. this new variant strain is also now emerging in other nations. We have no idea about the situation in other parts of the world. So I really, think it's very hard to predict what will be possible at the end of January, but you have to allow for the fact that international travel will not resume by that stage. You have to allow for that, and we'll have to wait and see.
Dr. Chand Nagpal, thank you so much for speaking to us and explaining the situation in the United Kingdom so articulately. It helps us understand what's happening. Thanks very much indeed.
Thank you. Thank you.